So, and Dr. Shu did your endoscopy, right?
Yeah.
Then you had your PET scan.
Yes.
And then you met with Dr. Bayani, right?
Yes. Uh-huh.
So the only part I don't have is the final part from Bayani. So let's just, you can kind of help me fill in the blanks, but I'm trying to get the final report from him. But Sattler called me and I saw the report. It looks like the esophagus cancer is pretty superficial.
Yes.
You know, it's not deep into the wall, and there don't appear to be any lymph nodes. So it seems like it's a kind of an early esophagus cancer. PET scan actually didn't show anything at all, which was kind of like, well, the way she read it was like it was removed. I'm like, well, I don't think so. There's still disease there because you had an endoscopic ultrasound, and we know there's something still there, but it's reassuring that there's nothing else.
Yeah.
So you tell me, you saw Bayani, what did he say?
Well, he said there were 3 options. One is the chemo radiation. Second is surgery where it's kind of endoscopy, where they go down the throat to the esophagus and take out the cancer. And 3 was removing the esophagus, which is out because of my age. And
so he thinks that's a bad idea, and you may not want it either. Well, I guess the question is about the superficial surgery. I don't know if that's good enough.
Well, he said the cancer may come back.
Right.
Which, I think at my age, if it came back, so what? I don't know. I'm 86. If it comes back in 2 or 3 years, I'll be, 90. I really don't care.
Maybe just leave it alone. Yeah, I mean, it's fair to say that. I mean, so would he do that surgery, or what did he say?
He didn't say.
He did. He said if you chose that, you would need to come back to him.
Yeah.
Well, I mean, but that's the point. I mean, so if you want surgery, he could do it.
Well, I don't know whether I want it or not, doctor.
What should he do?
What would you do if you were me?
Well, there's no right answer to these things, right? I think that, a superficial resection of this tumor may not be, it's not considered definitive, put it that way. It's not just a little superficial thing that can be plucked out. So if you were younger, the standard answer would be to remove your esophagus. So if you were of the opinion that, you know what, I'm never doing that esophagectomy, forget that. I want to do something kind of gentle, just like you just said. I want to do just kind of pluck it out. I know it's not probably going to be cured. I mean, it could be, but it comes back when I'm 88, 89, so be it. I'll deal with it then, or I won't deal with it then. I'll just be comfortable. I'm okay with that. I mean, as long as, and I don't argue with it either.
Yeah.
But if you told me, you know what, I want to give myself a better chance to be cured of it, but I don't want to have a major esophagectomy where they then have to kind of rehook me, then chemoradiation is more definitive. So I think that there is enough data that tells me that that type of approach would be more likely to put you in keep you in a remission. But there's no guarantee of that either. And that kind of therapy is toxic, right? So chemotherapy can be infused by vein. We have a protocol that we use that actually is pretty well tolerated. I think you would do fine with it, but just so you know, I mean, it can cause hair loss. It can cause some nausea, which we can manage with medication. It can cause some allergic reactions, which we can prevent with medication. It can cause some numbness and tingling. It can suppress your blood counts, infection, anemia, that type of thing. So these things are not trivial, but they're manageable. The radiation, if they did that, aiming it straight at the esophagus in a certain range, that, as you might imagine, can cause some different side effects. So it's going to kind of fry that area, so it's going to hurt, it's going to burn it. So you may have problems swallowing. You may, the food gets stuck. You might have some pain in there, reflux. You might get a sunburn because it's hitting your chest. It may damage some of the adjacent organs. People can have weight loss, can have other complications. So it's not a walk in the park. That's going to be a fair amount more toxic than a localized mini surgery. But that chemoradiation is probably, it's more aggressive and has a larger likelihood of keeping you in a remission. You could also reserve that too. You could say, you know what? I'm 86, I got heart and other problems. Just let Biondi cut out the little piece and I'll cross my fingers. And if it comes back and it's in the same spot, maybe then I'll do the chemo and the radiation. Nobody's going to argue with you. I mean, there's no right answer, right? If you were young, there'd be a right answer. But at 86, there really isn't a right answer. And some people would do nothing, right? They'd say, you know what? It is what it is. Let me be. And who's going to argue with you, right? So I can't, the point is I can't make the decision for you, but I'm trying to counsel you about what are the pros and the cons and give you some options and sort of get a sense of what you want.
Mm-hmm.
Well, I think you should do something.
Yeah, I'm not suggesting you do nothing. I think that would be a bad choice because if you were like really in bad shape and we thought you might die from heart problems within a few months, yeah, what are we doing? But nobody told you that. I mean, you have heart issues, but if you didn't have this, we're still hoping you live many years, right? Nobody told you otherwise. So what we don't want to do is just ignore it and then make your life shorter because we ignored this and then it grew and caused problems.
Yeah.
So to me, I think Biondi advised you against doing the full esophagus.
Oh, yeah.
And you don't
definitely,
you don't want it, right?
No.
So that's out.
No.
Doing nothing is out.
Yeah.
So the extremes are out. So then the question is, do you want Biondi just to do that superficial thing? Or do you want to try a bit more aggressive and do the chemo radiation? If you want to just do the superficial and leave the chemo radiation for later, if it comes back, I'm okay with that. It's less aggressive. Maybe we'll get lucky. Maybe, right? If we don't, we'll deal with it later.
Yeah.
If you want to be a little more aggressive and do the chemo radiation now, is reasonable. I think you're healthy enough, strong enough to consider it. But it's going to be harder. And it's a course of about 5-6 weeks, something like that, where you come in here to our infusion room down the hall, get an IV, they infuse you every week. Takes about 2-3 hours. Radiation takes about 5-10 minutes, but that's Monday through Friday.
Oh, it's every day.
So like 5-6 weeks. And yeah, it's not easy. So it's easier than an esophagectomy, but it's not easy. So I think you might want to think about it, or you might be pretty clear. I mean, did he get into the details of how that minor surgery would be?
Well, it's like the endoscopy where they go down.
He thought that would be pretty easy to recover from?
Yeah.
He said.
Yeah, well, he just said there's a good chance the cancer will come back. And you can deal with that when it comes.
Well, so that's the crux of it, right?
Yeah.
But there's a small chance it won't. So the question is, if it comes back locally, did we lose anything? Let's say it came back locally 2 years later. Well, then you had 2 years where you didn't have to deal with this horrible treatment, right? And then maybe you would deal with it, or then maybe you won't. Maybe you say, you know what, I'm 88 now, I'm definitely not doing anything. Or you could be a little bit more aggressive now. If you're more aggressive now and it cures it, that would be wonderful. But you could be more aggressive and you could end up having major complications. You could get infections. You could end up in the hospital. You could get swallowing issues and lose a lot of weight.
Yeah, that would be
It
awful.
can stress your heart. I mean, all these things are not trivial, right? Or you could do all that and it still might come back, and you're like, why did I do that, right? So, I mean, if I knew what was going to happen, it would be very easy to tell you what to do, right? But there's not a good test for me to know. Otherwise, my job would be easy, right?
Yeah.
It's not easy. It's hard. So we got to kind of do the best we can. Appreciate it.
But you
Okay, I
didn't
got
get to talk to him.
I can talk to Biondi as well. So he says, chemoradiation definitively, Or you could have chemoradiation, which is what we're talking about, followed by then doing the resection. So I don't think he meant to. I don't think he meant to imply that he would. At least his note doesn't say that. His note says he would do chemoradiation, or you would have that choice, or you could do chemoradiation and then remove the rest of it. So I don't think he mentioned. At least that's not what he's implying, to do it without it.
Yeah.
If you don't want the chemoradiation, I can talk to him about it. Would he just be willing to do that without it? And that would probably be the highest chance of it coming back, but we don't know that.
That's what he said, yeah.
But how do you think about it at this point?
Well, I'm really not in favor of the chemo.
You'd rather not do chemo, period, because of the side
Yeah, and the
effects.
radiation, when my friend had radiation and it burned his heart and so forth,
Yeah, so you're kind of leery.
yeah, so I'm leery about that. I think the surgery would be best to get in and take the damn thing out and
If he'll
and
do
see
it,
what
though,
see what
without.
happens.
Okay, so let me just. So your basic, like, let's say Bayani says, sure, I can do that. The
Yeah.
chance it's going to come back is fairly high,
Yeah,
but that's all you want to do. It's okay. Then we'll do that. That's kind of what your preference is. Is that correct?
right now,
Just
yeah,
do that.
yeah.
If he tells you no, I won't do that unless you do chemoradiation
Oh
first.
well, then
That's
you
a
know,
different statement.
Yeah.
I don't know how you feel about that.
Yeah, well,
Because sometimes when we're going to do some type of resection, they'll do, we can do a little less radiation. I don't know that really makes you feel that much better, to be honest.
Yeah.
It's still a lot of radiation. So let me see.
okay. That's what Wayne said. If you're going to have that surgery, he says you're still going to have chemo.
Mm-hmm. Dr. Wayne.
Yeah.
Okay, I'm just going to say.
Yeah.
Does he have to have the radiation?
Hmm?
Well,
That just
I'm just
goes,
going to say he's leery about
I don't want it.
chemoradiation and would rather avoid it. I'm going to say, would you be willing to do endoscopic resection alone? Okay, so let's see what he says. So let's say he's willing to do that. You'll say, sign me up, sort of.
Yeah.
If he's willing to just go in there and cut it out, you'd say, okay, I'll try that.
Yeah.
See, and hope for the best. It's okay. And if he says no, then we're gonna kind of have to come back and discuss this.
Yeah.
If he says no, I won't do that unless we do chemoradiation first.
No.
Then you'd say,
then you're not going to do anything?
No.
then your answer is I might not do anything. It's fair if that's your choice.
Well,
I have a feeling I don't think he's going to be that. He just dictated that he assumed that you would do chemoradiation first. But if you understand that the chances of recurrence are pretty high and the chances that it may not be cleared are, because he could go in there and cut it and then we could get the pathology back and there's still disease left behind. So if that's the case, then which is just a risk. Then there's disease there.
And then he could have chemo after.
Chemo radiation after that. You could, in a definitive way. We could do it like sort of backwards. I mean, we could do it that way. And I could tell him that. Kind of maybe we'll get
the chemo is 6 weeks.
Something like that, yeah.
Yeah. Do I absolutely have to have the radiation?
Yeah, if you don't do the definitive, the radiation plays a major role of really kind of controlling the disease in that area. It sort of fries and kills the cells. Chemotherapy is really, of the three modalities, probably the least important, to be honest.
Yeah.
And that's what I do, but I'm honest about it. It's in this particular setting where you're going for cure, the key is to kill it. And the chemo kind of helps the other things do their job. The radiation really kills it. The chemo makes it work better.
It doesn't affect your heart?
Well,
yeah.
I would give you drugs that, I'm going to avoid drugs that would affect your heart.
Yeah.
You could have stress, and the stress could cause heart problems, right? Just like stress can cause heart problems anyway.
Yeah.
I mean, I can't guarantee you that it's not going to cause you problems. I don't want it to, but I have to counsel you that it's possible.
Yeah.
Right?
Would you need to talk to his heart doctor?
I can. I mean, I think your heart doctor does your heart doctor think you're a candidate for surgery?
Haven't talked to him. I don't
Who is
know.
it
Dr.
again?
Wyman.
Yeah, I mean,
I
I
don't
think
know.
if you were going to do a procedure, then, didn't like Sattler and Shue get Wyman's approval to do the endoscopy?
Well, they did with the blood thinner, yeah.
No, I mean when they did these endoscopes.
No.
They didn't ask him?
Just stop taking the blood thinner, that's all.
Let me see if...
Yeah.
Yeah, he says he'd be happy to. So I said, would you be willing to do endoscopic resection alone? He said, sure, he's happy to do it. So why don't we just do that?
Did you hear him?
So Dr. Bayani said, he just messaged me. He said he would be able to, he's okay to just go in and do that minor surgery.
Yeah.
And then have you come back and see me afterwards and we'll review it. And if it looks like there's disease left behind, then we're going to have a serious discussion that, it's going to grow. And then maybe I would talk, then you decide, do I want chemoradiation or do I just accept the fact that it's going to come back?
Mm-hmm.
So, but he's willing to do that surgery first if you want.
Okay.
Is that what you want?
And that's minor. I mean,
He's going to have, I don't want to pretend to counsel you about it. If he didn't really get into details, he really needs to sit with you and talk about it.
Yeah.
So, I'll just say,
Yeah.
you
I'll
want
just
to
say,
do it that way?
Can you ask
Yeah. Yeah.
your secretary to schedule
Mm-hmm.
a follow-up appointment? Okay, so let's do that. He'll take care of it. So he'll ask his secretary to get you in. Why don't you call Bayani's secretary and say, you know what, Haradner Bayani spoke, sort of. We texted, and the plan is I'm going to come back and Bayani's going to do a procedure. So I need to see him again. So tell him to book you. Bayani will work on it. Let's get this planned. I don't know when. It's not like some emergency, but at the same time, you don't want to wait
Sooner the
5
better.
months and have it grow, right? So could it be done this year? Why not? As long as he can coordinate it with you.
Yeah. Okay.
And then why don't I bring you back to see me in January?
Okay.
I'll put it like that in the notes. I'll say, return to clinic in January after surgery with Dr. Bayani.
Okay.
And if for some reason the surgery is like 2 weeks later, then push my appointment back.
Okay.
It doesn't make sense. See me after the surgery.
So what do they do then after the surgery to see if they got it all?
The pathologist will look at it.
Oh,
So they'll give him a big piece and he'll section it out and cut it and look at all the margins.
So he'll know right away.
And it, well, not immediately, but yeah, over time they'll have a final result after a few days.
Right.
And then when you see me, I'll know.
Yeah.
And then we'll talk about it. And
Okay.
then we'll discuss it. And and I'll be honest with you. If I think it's likely to come right back really quick, then I'd probably try to twist your arm to do something.
Yeah.
And if it looks like it's all gone, maybe we'll just cross our fingers, right?
Okay.
I mean, I'm not God, right? I don't know the right thing, but we just got to do what we can do sometimes,
Okay.
right?
You got to keep up with my mother.
All right. So why don't I, do you want to make an appointment now? If you do, you're welcome to go in the lobby, make the appointment. If you don't, they'll just call you. But basically, I'll set it up for January after you've had the surgery, assuming you do your surgery in December.
Okay.
Okay.
Okay?
Well, yeah. Gonna make the appointment with you sometime in January.
Mm-hmm.
Okay.
Like after your
We'll
surgery.
do. Yeah.
All right, good. Well, nice to see you.
Thank you.
I'll send a note to
Okay.
Sattler, too, just
Okay.
kind of.
Okay.
Okay?
Thank
Thank you
you.
very
You're
much.
welcome. Take
All
care.
right.